Dr. Jessica Zitter is with us today to discuss the status of the 53 million caregivers in the U.S. and her new documentary, Caregiver, A Love Story. You're connected with the Heart of Hospice. I'm Helen Bauer here with Jerry Finter.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care. At the Heart of Hospice, we're always looking to connect our listeners with resources and services that can enhance their hospice experience. If your company provides a service for hospice patients or hospice agencies, the Heart of Hospice would love to partner with you to expand your outreach. To discuss customized sponsorship options, send an email to host@theheartofhospice.com. You want your clients to have the best hospice experience possible, and the Heart of Hospice can help you make that happen. Now on to today's episode.
We are so privileged and entertained and just so happy to welcome our friend, Dr. Jessica Zitter, back to the podcast.
She is so full of energy and life, and she's got this spirit of, just wanting to help and change things and change the world. And
it's not Pollyanna. She's not blowing smoke. It's a can-do attitude with a lot of realistic optimism.
There you go.
There you go.
Yeah, that's it.
So Dr. Zitter is a physician specializing in critical care and palliative care medicine. An interesting juxtaposition. She practices in the San Francisco Bay, California area. Dr. Zitter's work has been featured in the Oscar and Emmy-nominated documentary Extremis. And you can also see her in her new film, Caregiver, A Love Story. She's a nationally recognized speaker on the topic of dying in America, and we are so pleased to have her as our guest today. So here is our discussion with Jessica Zitter.
Dr. Zitter, it is so good to have you back on the podcast again. Thank you for joining us.
So honored. So happy to be with you both.
So you have a new documentary coming out. You did another one prior to this one, and it was called
Extremis.
Extremis. Thank you. I always say that wrong. That's why I let you say it. But the new one that you have coming out is called Caregiver, A Love Story. And we got to see the trailer for it, and I'll just say that it.
Oh, you're a big tattle.
I am. I
was in tears at like 30 seconds.
Right.
Goodness.
Right. But so that's always how you know that it's good. So tell us more about how this documentary got started. What was the inspiration? What was the motivation behind it?
Well, you might be surprised to know that the inspiration for this film was not to make a film about family caregiver burden because, drumroll please, I didn't really know much about family caregiver burden when I started out to make this film. I thought this film was going to be about this amazing woman, Bambi, who was a friend of mine, very dynamic woman, who was having this incredible epiphany about her death and really taking the bull by the horns and deciding that she was going to make her final time on earth as good as it could be. And she got hospice involved. And the first few weeks were just incredible. And I thought, let's make a film about how great it is to make the right decisions about your death. And it was really only after Bambi was dead for a year, had been dead for a year. And I started to look at the raw footage, to put it together with my co-director, Kevin Gordon, that I started to see that the real story that I wanted to tell was about her husband, Rick, and what happened to him over the course of those 9 weeks.
Interesting. So in this story, this was kind of an accident happening then. You intended it to be one way, and it turned out to be something different.
Yes. And I showed the film to another person who works in hospice, a hospice nurse, and she said, I've got to be honest. She's like, I'm really surprised at the scene in the film where you're telling Rick that he needs to ask for more help from hospice. And Rick says, yeah, what they can give me is another 45 minutes a week. And my mouth hangs open. She said, I was surprised that you were sort of, as a palliative care doctor, so unclear about the limits of what hospice really is there to do and what they can do with the resources that they have. And I said, you know what? I'm not proud of it, but you're right. I was shocked. And if I was shocked as a palliative care doctor, you can just imagine how other healthcare professionals, particularly those who are focused in the hospital setting, have no idea about this rising public health crisis.
It's absolutely true, because you hear physicians all the time when a hospice referral is made. Their intent, their purpose behind the hospice referral is the family needs more help.
Yes.
Yeah, that's not going to help. Yes, it's a better fit. But if you're looking for caregiving assistance, it's way beyond what we do in hospice.
Absolutely. Hospice gets paid less than $200 a day to do very essential things that couldn't, if those were not done, those services were not provided, that patient could not be in the home. Bambi could never have stayed home those last 9 weeks, which was her desire and her goal, without the support of hospice. But what was hospice doing for those less than $200 a day? Hospice was managing all of her symptoms, providing all of the medications and durable medical equipment to support her symptoms. They were teaching Rick how to manage her symptoms when they were not present, because hospice is not present 24/7 by any means. That's not what hospice is there for. So, all of the tasks that are sapping, like laundry, and there's an interminable amount of laundry when you have somebody who's bedridden, and the bathing and all of the other house management things. Who's doing that? Well, Rick is so busy. The average caregiver is working. The average caregiver is on duty 24 hours a week. And that's during waking hours. I mean, you just can only imagine how little time there is to do the very basic things that are required to run a household.
So I'm sure that through all of this experience that you've had in making the documentary, you also have done some research about caregivers. Oh. Tell us what you've learned about caregivers, and maybe, the statistics, but also on a personal level. What have you learned about caregivers?
Oh my gosh, I've learned more than I can really begin to explain. And I'm going to give you a few numbers, but in addition, don't forget this film was finished right before the pandemic. It was finished in March 2020. So here I am finishing the film, writing a keynote to go with the film, doing tons of research and learning about the state of this invisible public health crisis and rising public health crisis, because I'll talk to you about the demographic shifts in this country that are leading to this rapid rise in caregiver burden. And then come along COVID. And COVID tipped everything. All of the caregiver burden that was going along, rumbling along in this very, very devastating way, causing financial, physical, medical, psychological, emotional problems for families who do caregiving. All of a sudden, the pandemic comes along, and adult day programs are closed, and you don't want to have paid caregivers, if you can afford them, in your home, and family members aren't coming over because they don't want to get grandma sick, and so this caregiver is all of a sudden, who is already struggling, all of a sudden is completely alone with this person that they have to take care of. And the numbers from the pandemic, I'll give you the numbers about caregiver burden in general, but with the pandemic, we saw a massive rise in caregivers compared to the non-caregiving population of dependence on alcohol and drugs for managing stress, at 10 times the rate of the non-caregiving population, serious contemplation of suicide. 1 in 3 caregivers in the August morbidity and mortality weekly report reported seriously considering suicide in August of the pandemic.
Oh my goodness.
2020.
1 in 3.
1 in 3.
Wow.
Well, so the rate of just mental suffering and depression has increased exponentially because of the pandemic.
Unbelievably. And I think what the pandemic has done, you always want to find some silver lining to something as devastating as this pandemic. But here's a silver lining. The silver lining has made it absolutely clear, I think, because this is such a prevalent condition to be a caregiver. 1 out of 5 Americans is a family caregiver. So with that, and with the exacerbation of this burden and stress and dysfunction in our society, this pandemic has made it, I think, absolutely incontrovertibly clear that we can't continue to do business as usual. We have got to figure out a way to support all of these people, who is essentially all of us, because we're all going to be faced with this problem. It's so common. Let me just tell you a little bit about the changing demographics and why this you can imagine. I mean, right now, every day, we have 10,000 baby boomers turning 65. Every day.
Every day.
So you can imagine that the number of people living with chronic illness, with serious chronic illness, disabled, not dying, by the way, not hospice qualified, but just disabled and requiring support with their ADLs, has risen. But here's the catch. We are at a 35-year low in terms of our birth rate in this country. And families, as you can imagine, are dispersing in ways that they never have before. And so there's this rising number of people who are going to need care in the home. And there's a profound drop in the number of people who are going to be there to provide the care. And that change in the ratio is continuing to change rapidly, to the point that in 2015, there were 44 million caregivers in this country. And in 2020, according to the National Alliance on Caregiving report, we are at 53 million. Wow. So those numbers do not lie. And those numbers are going to continue, as everyone here can imagine, to get worse and go in the wrong direction. And right now, we do not have a national strategy of any sort to provide support to caregivers. So people are just becoming progressively financially disabled, medically challenged and sick, and having tremendous work impacts. It's not sustainable.
Yeah, what we're seeing oftentimes is that here's the caregiver that, voluntarily, offering to do this, and yet they're also trying to do their normal life, which may be including working, outside of the home 40 hours a week or more, and then coming home to be a caregiver, or they're having to give up their job to become a caregiver, a full-time caregiver for their loved one. And the changes that occur because of that is just so stressful for them. So you're saying that there's no safety net out there for our caregivers. What can most caregivers do to find the help that they need? Are there resources out there?
Yes, there are resources. There are definitely some resources that are out there. The problem is that many of the resources that exist are for people who are on Medicaid. And so Rick, even in this film, who did not have a large amount of money, but he still made too much to qualify for Medicaid. And by the way, Medicaid benefits are not mandated in every state. So in some states, you're out of luck, even if you're on Medicaid.
Right.
But with that, there are some benefits that people can find. Part of the problem is that it's incredibly confusing to navigate and figure out what benefits you might qualify for and what benefits you don't qualify for. There are organizations like the Family Caregiver Alliance, the National Alliance on Caregiving. You can go to our resource page on the caregiveralovestory.com website to find some of those resources. There are some 800 numbers that you can call to at least get started. But the honest truth is a lot of family caregivers, by the time they're so stressed that they're saying, I need help, they may be just too overwhelmed to even look for help. And by the way, you said, Jerry, people volunteer to do this job. I don't even know that that's true. I don't think that people actively volunteer to do this job. They just assume, well, I'm the daughter, that's what I do, and I'm the wife, and that's what I do. So, there's a statistic that's being measured in the caregiving world about whether or not people have had a choice in their caregiving role. And one of the things that's really important to know is not having a choice is highly associated with poorer outcomes in terms of psychological outcomes, in terms of medical outcomes for the caregiver. And minority communities are much less likely to have a choice in their caregiving than non-African American or people of color communities. So this is obviously puts our communities, vulnerable communities, at a disadvantage. So it's very, very important for us to think about that. And, there's a stigma about complaining. or asking for help if you're a caregiver, because, think about how we look at the state of caregiving in this country. Think about how we think about, I don't know if you guys are probably we're all about the same age, maybe, I don't know. But remember in 1970, there was a movie that came out called Love Story.
Sure.
Well, that was a caregiver. Ryan O'Neal was a caregiver, and it was so romantic. What was that?
Yeah.
Remember that?
It's a little bit before my time, but yeah.
Oh, come on. You remember that.
But it was so romantic. He sat by her bedside and stayed there until her final breath. The fact is, that's our Hollywood version of what caregiving should be. And none of us, that's Hollywood. That's not real life. You could be completely in love with somebody, as Rick was. Rick and Bambi were newlyweds. Love is not a substitute for a national strategy.
Very good. We were having a discussion about disenfranchised grief just a couple of days ago. And I told Jerry, we have these caregivers that are disenfranchised grievers because they didn't want to be the caregivers. They never expected to be the caregivers. And because of society expectations or family expectations, there's an assumption. You're the oldest single daughter. You get it. You're in charge of this. This is your parent who was incarcerated, drug abuse, whatever, spousal abuse. There's an expectation that you're going to be the caregiver, and you're going to like it, whether you want to or not. So I think when we talk about disenfranchised grief, let's talk about disenfranchised caregiving. Yes. I don't want to be here. Yes. This was never supposed to be my job, and I don't even like this person.
This person abused me. This person neglected me. Why am I in this position?
And you want me to turn him every 2 hours? You got to be out of your freaking mind.
Exactly.
Yeah.
Yesterday I just heard a story about a woman who was caring for her mother, didn't have a choice. I don't know a lot about this woman, and I'm sure it was very complicated, but her mother was a very active dementia patient who was constantly leaving and going away and yelling. And this woman, the mother was found duct taped to a chair in her daughter's house by one of the other siblings. And then they called the police, and this woman went to jail.
Wow.
Now, I am not in support of duct taping somebody with dementia chair. No. My goodness, I in no way. And that woman should never have been in that house with that daughter. However, what must have been happening here for this to happen? I mean, that this woman didn't somehow have any other way of just. It is a sign of a sick society, because that should never have happened. If this woman was not able to take care of her mother, this woman should not have been in the house with this daughter.
Yeah, we're the siblings who could come in and at least relieve her occasionally and give her a time of respite or something. Right. Oh, goodness. So how can we fix this? What's on your wish list?
How can we fix this?
Yeah. How can
we don't have that much time on this podcast.
But what's on... That's true. Yeah. How can we help support these caregivers? What kind of resources can we give them?
Here's the thing. As I've done my research, I've seen all the areas in which there are major problems. And I can think in each one of them of things that we can do, whether you're on an individual level or more on a policy level, that could impact the lives. And frankly, at this point, we got to grab anything we can, because every little thing is going to make a difference. So what's my first thing? First thing is every single person in this country should be aware of the problem of family caregiver burden. We should not let this be an invisible epidemic anymore. Everybody who is a caregiver should be recognized by those around them as somebody doing heroic work, praised, and appreciated. I think that is a very important first step. If you know somebody at your workplace who's a caregiver, say, thank you for the work you're doing. I know it must be hard. If you're a doctor or a nurse and you have a patient who's getting ready to be discharged, you make sure that in addition to trying to connect that person with some social services on the outside, or having your social worker connect that, and that infrastructure doesn't even exist, by the way, in the hospital right now, but you just take the time to say, this is a big life change for you. You're about to go home, and now you're going to be a caregiver. You've got, I know you love your mother and I know you want to take your mother home. This is going to be at times a hard job and you're going to need to get help and support. Hearing that from your doctor or from your nurse or from a social worker, I think can be very, very validating and empowering. So just that recognition on an individual person-to-person level is very, very important that we do it. I think second level is, okay, so do something for that person. If they're your neighbor or if there's somebody in your church or your synagogue, figure out what might be helpful to them. Could I come over if you know them well enough? You don't want to be creepy, but would it be helpful if I gave your daughter a ride to blank? Would it be helpful for you if I came out and helped just clean up your kitchen? Or would it be helpful if I brought a dish? And if so, what would it be that you would like to eat? I don't want to bring you something that you wouldn't like. Could I do a load of laundry? Could I take some of your dry cleaning to the dry cleaner? I mean, there's so many little things that if Rick had just even another hour and a half in the week to sit down for a second and rest because someone took some delegatable tasks away from him, would have been a big difference. And then I would say on the next level, let's start talking about infrastructure changes. I don't just mean through the government, state, federal, local. I'm talking about at your workplace. I'm talking about in your community. What are some things that would really make a difference for the caregivers? For example, workplace infrastructure. 60% of caregivers work, most of them full-time. And almost all of them, this is a striking statistic, almost all above 90%. Of them don't feel supported in their workplace. They don't feel supported enough to even ask about what the benefits are for their caregiver status. What kinds of things might they be able to get? Even if that particular workplace is sophisticated enough, for example, to offer long-term care insurance, or some of them maybe pay for adult day programs for the worker's mother who's got dementia. A lot of people don't feel comfortable asking about it because they're afraid that they're going to get penalized. So create a culture in that workplace where the HR department really acknowledges family caregiver burden and says, we support our caregivers. Employers are losing a lot of money. It's not just the working caregiver that's suffering. The employers are losing $65 billion a year in this country because of employee turnover, employee illness, the caregivers getting ill from their jobs.
Right.
And quitting. So it's a lose-lose situation. Let's change the culture in the workplace. I mean, there's so many things we can do. And then, of course, right now, let's talk about this. Right now in Washington, there are active negotiations that are happening about how much to support caregivers and other working class people in this country who do important work like caregivers. How much do we want to support them in terms of our safety net programs? And I think that's an active conversation, and each person has to decide what they believe is important. And if you feel strongly, you should reach out to your congressperson.
We wanted to take a moment to remind you that the mission of the Heart of Hospice is to be an advocate for quality end-of-life care. One way we do that is by providing education and consulting for hospice and palliative care professionals. The leadership of the Heart of Hospice has over 20 years of combined hospice experience. We can provide training for your interdisciplinary team through webinars and virtual events on topics such as self-care and grief management for professionals, diversity, competency, and healthy boundaries, or a topic of your choice. If you need a speaker for a leadership or community event, please contact us at host@theheartofhospice.com. Now back to today's episode.
So as you're involved with caregivers, as you have been involved with caregivers and seen firsthand what they're going through, what would be the best thing that you think, from on a national level that Congress could do to help the caregiver situation?
Well, I mean, there's currently in the programs that are being discussed, there's a lot of components to it. For example, one proposal is to pay caregivers money, a tax credit for doing this job. treating it like it's really a job. There are other proposals to put money into people's Social Security, as if, even if they're not working, but if they're actively caregiving, to put money into their Social Security. There are obviously lots and lots of programs that can be made more robust and more inclusive so more people can afford them. And I think that, creating another proposal that I think is really important is to create an entire army of navigators that are there to support family caregivers and tell them what kinds of things they can do. So, for example, if you're discharging somebody from a hospital, there's a central place that you can send them that will help to set them up with all of the appropriate resources for that particular situation that could be helpful. So like a hub for caregivers to really go to, regardless of their socioeconomic status, regardless of anything, but just a place to start so that they aren't feeling so lost and disenfranchised. I mean, I could go on and on, but there's a lot of things that are being presented as possibilities that are being discussed and negotiated. And I do think that anybody who's inspired by this podcast should go and look a little bit more about, just Google it. There is tons of stuff out there right now about the active conversation about what should and shouldn't be included in the support of family caregivers. I think making caregiver, the professional caregiver workforce, paying them more, making that more accessible, their work more rewarding for them so that we can build up that workforce. Right now, the professional caregiver workforce has shrunk so much because that's a very tough job, not very well paid, not much room for advancement. And I think the pandemic has certainly worsened that and has made it shrink significantly more. So even people who can afford, which is not a lot of people, who could afford to bring paid caregivers into their home, can't find people. So we've got to make that more affordable. We've got to make it more accessible. We've got to support those professional caregivers and lift up the work that they're doing, which is so critically important. It's all the glue that's going to hold our society together. And right now, it's not working very well. So I think these are just some of the things that I think could be very, very helpful.
Our system is so fragmented when it comes to resources. The idea of a caregiver hub, together, all of that together, wouldn't that be an amazing thing?
Absolutely. How do we deal with other public health crises in our country, right? Smoking, lead poisoning, domestic abuse. This, if I haven't convinced you yet, this is a rising public health crisis that is going to impact every one of us in some way. I don't care what political party you're in. I don't care what the color of your skin is. I don't care how much money you make. This is something that we're all going to have to contend with. And so let's treat this like the public health crisis that it is. Let's put PSAs out there. Let's put ads on buses. Let's really, really take this seriously, raise awareness, and start putting some money into fixing this problem.
Oh, the fact of the matter is, if you are not a caregiver for someone else, you will eventually need a caregiver for yourself.
That's
so
right.
it impacts us all in one way or the other, just depending on what angle you come from.
Absolutely. Absolutely. It's really, it's a very human problem in this country that we've got to address. And I believe that if we really as a country kind of take it seriously and look at it all together from that human lens, that it could be a really unifying and healing experience for us all to try to soothe this problem and solve this problem, because it really does get right down to the basic humanity of how we want to live, how we want our families to be able to live, and how we want to treat each other as human beings.
Yeah, it really does come down to that personal level eventually. Either you're going to be a caregiver or you're going to need a caregiver. So it's going to come down to that personal level.
Right.
So with this huge population of people who are caregivers, I think the caregiver love story is going to resonate with a lot of people out there, including our hospice and palliative care professionals as well. So along with the documentary, you are also creating something else to go along with it. Tell us more about that.
Well, first of all, I always believe that, taking films that really get you into the house or into the hospital room of somebody and kind of bring you into that human encounter and that human experience in the healthcare system or around serious illness is something that I think is really kind of eye-opening for a lot of people, again, including healthcare professionals. And then I think with that, you have to have accompanying sort of workshops that are geared particularly towards specific audiences in order to really help them move forward in terms of what they know and what they're going to do differently. And so we've actually created for Caregiver: A Love Story, we've created several workshops and piloted several of them. First of all, we created one for family caregivers themselves, but then we've created a couple for medical students and medical residents to try to sort of improve and broaden the training around family caregiver burden for this group of people. And then we just got a grant from the Hospice Giving Foundation to create a workshop for hospice staffs. And why are hospice staff so important? For a few reasons. First of all, because hospice is a magnet for caregivers. When you're a hospice worker, you're going to have caregivers all around you, right?
Right.
And so we want to be really attuned to this issue. And I think a lot of hospice people are already attuned to this issue. The issue is that it's touchy. It's a touchy thing. For those care recipients who are hospice appropriate and who have chosen hospice, which is a small fraction, by the way, of the entire caregiver community, because most caregivers don't have access. Their care recipients don't have access to hospice.
That's right.
But for that small group, that very visible group of people who are actively 6 months away from death, who clearly need caregiver support, you can imagine, and I think hospice staff can imagine how they get unfairly blamed for caregiver burden. On top of already feeling the moral distress of watching caregiver burden all around them and not really being able to do anything about it. A hospice, is paid, not a huge amount, to manage all of the medical aspects of the care of that person so that they could be at home in the first place. There often isn't a lot of time or volunteer hours, which is really what would have to be used to provide any kind of domestic support. That's not really what hospice's purview is. And so the hospice worker comes into the home and sees people like Rick getting progressively stressed and deteriorating and not having anything really to offer them. They're not going to go in and do laundry. They're not there for that. They have, other responsibilities. And so I think that the hospice community is a very important community to show this film to. And to talk about that fact, to talk about that moral distress, to talk about that maybe unfair blame or sense of defensiveness that some might feel, which I certainly can imagine feeling myself. And then to talk about, well, how do we move through this? Because you are going to be dealing with lots of caregivers. How do we make our hospice staffs as effective as they can be for the caregivers among them, regardless of all of this distress that's around them?
I don't you think sometimes there's some guilt associated with it too? Because I always felt limited with my caseload, running down the road with my hair on fire, talking on the phone, driving and eating my lunch at the same time and thinking I should have stayed 30 minutes longer. I could have put those clothes in the washing machine. Things like that. I think, we know there are expectations out there, but don't we also have some unrealistic expectations of what we should be doing as kind humans?
But as I said, I want to reiterate, that's volunteering, right? Yeah. That's not really in your job description because you have all these other fires to put out. Sure. You have to put out the other fires and you also have to take care of yourself. And so the question is, should we be depending on the hospice, the loving hospice person or the loving daughter or the loving neighbor to to maybe do a good deed that day if they have the slightest bit of extra energy, or should we have a national strategy? We should have a national strategy. Right. We shouldn't be taking every last bit of everything out of everybody around for free so that we can support these caregivers who are in such need. We need to have a strategic approach to supporting these people.
Right. Haphazard isn't going to do it.
Right. It's not. It's going to burn everybody out. And it's going to make it so that hospice, which is a precious, precious service, is going to start just feeling this distress and feel burnt out the way we often do in hospitals. Let's not burn the people out who are there to help. Let's figure out what they need to support and what is needed around them so that there isn't this desperation.
Absolutely.
Yeah. In a hospice, like you've said, we only have a limited amount of funds to actually provide the services that we provide. So maybe there's something there it could be part of the national strategy as well to increase that amount so that we could provide some personal services in some way.
Yes.
We have volunteers, but right now with the pandemic, volunteers are almost non-existent because they don't want to be going into the homes either.
Of course.
And so it's a struggle. It's a struggle.
Again, I want to say over and over again, we cannot depend on volunteers to solve family caregiver burden.
Right.
I don't care how good-hearted people are. And I like that idea, Jerry. I like the idea of bringing it sort of in a centralized way of supporting hospice more with more funding so that it can pull, under its purview so that it's a more coordinated approach. It's not just all these different services kind of haphazardly coming in, but you really kind of get some kind of structure. If hospice wants it to go under them, hey, I'm all for it. I think it makes more sense to figure out how to centralize the care of a family under one group. But nonetheless, you can't do it at $200 a day. You can't.
Right. And true, too, we also need to realize that the caregivers that are affiliated with hospice, who are receiving hospice care, are much fewer than this huge 53 million number. The percentage of that 53 million that are receiving hospice care is very small compared.
Absolutely.
Yeah.
So it's got to be more than just hospice that receives, the help. There's got to be a bigger picture than that. And so we've got to work on that as well.
But if we're putting in a plug for more money, then yeah,
right.
we'll raise our hand for hospice. Yes, we'd like more money.
Right. No, but I think it's true. I think so for people who are not in the hospice category, but who do require, in-home support services, some kind of in-home support, then let the agencies that are taking care of patients who are not hospice, but just doing in-home support, let them have, again, I'm not here to solve that problem. All I know is that we don't have enough funded support for these types of tasks. And that's why people are going under.
Yeah. You can't survive on good vibes.
Yeah.
No. That's not going to be enough because we already know that we have a broken system. And it's becoming larger. And if we don't act proactively, what kind of mess we'll be looking at next 10 to 20 years?
Absolutely.
Yeah. The need is only getting greater.
That's right.
By huge amounts. Yes.
Yeah.
So let's talk about what's changed over the last year and a half. Because, this is, what month is this? September of 2021. And it's been a wild ride through the pandemic, the PHE, and it's had a lot of impact on hospice and palliative care teams. How do you think hospice and palliative medicine has changed in the last year and a half? Because I think everybody's been changed on some level.
Absolutely. I mean, so much has changed. I think personally, professionally, specialty-wise. I think that the most obvious thing that we can sort of look at is the advent of telehealth, which I am really excited about, not only in the palliative care world, but even in the intensive care unit world. The idea of putting people where they need to be, putting care providers, physicians, nurses, whoever is needed in the place that they need to be. And of course, it takes a disaster or a pandemic to show you how important that is. But then once that, hopefully, God willing, is passed, I think it's a technique that really can lend something really positive why should a palliative care, congestive heart patient who lives at home, who's really debilitated and is getting palliative care, which is a wonderful thing, why should they come into the clinic every single time they need to talk to the palliative care team? Let's have, telehealth be a part of what we offer. I think this is a really exciting breakthrough that really required, honestly, in some ways, I think the pandemic for it to happen. And I think that this is a gift that we should really use in once we're out of the out of the woods on the pandemic. And I mean, here's the gift of it as well. I mean, before we started typically, constantly using Zoom, the sister from Chicago or the brother from India was never a part of the family conversations. We now are having really robust family conversation, advanced care planning, decision-making in the hospital in ways that I think are much healthier, much more inclusive, and really get to the heart of what needs to be done. So I'm thrilled about telehealth and telepalliative care. So I think that's been a real change. I think that one of the things I'm not so thrilled about is, this concept that palliative care is the team to be delegated to when there's communication that needs to happen. And you can imagine when there's triaging that's happening. I mean, people are so rushed and stressed and frustrated that, send this to palliative care, send this to palliative care. But the fact is, one of my biggest calls is that we do more and more primary palliative care, and that, that the ICU doctors and the ICU nurses and the nurses on the floor, that people all see it as their responsibility to have conversations and do communication. So I think part of what I'd say I'm a little discouraged about is that it really feels, again, like everyone's gotten a little bit siloed, and that's a problem. On the other hand, the good part of that is that I think more and more people are seeing the incredible power and benefit of palliative care and of these, communications in general, and really are starting to reach for it, I think, more than they used to. But again, it just like the caregiver problem, it is not sustainable to have people saying, wow, this is great, we need more communication, and then just to delegate them to palliative care, because there's never going to be enough palliative care people to have those conversations, many of those conversations that need to happen. So I think we've still got to, we've got to adjust on that a little bit more. And I really think we've got to be still working on teaching non-palliative care, the non-palliative care healthcare workforce, all about communication as well, so that they can do the basic primary palliative care that needs to be done.
I've heard more chatter about palliative care in the last year and a half than I have in a really long time.
Yes.
I've learned about it quite a bit. And of course, I've been a hospice practitioner for almost 11 years, and palliative care is built into all that. But palliative care as a specialty, I think there's been so much more awareness of it, and how the collaborative relationship needs to happen to include palliative care as its own strength. As its own strength. I think that's one of the things that I've seen come forward. And I think the weaknesses that have been exposed were things, I agree with you. We knew they were there, but nobody was talking about them. A depleted, burned out workforce.
Yeah.
Like that hasn't been an issue.
Yeah. But, I mean, the honest truth is with a pandemic, we're all human. And I think that there is a lot of incredible overwork, fatigue, moral distress, disconnection from our patients. It's worrisome. And I think that we have to keep talking about that and being honest about it, so that we can get through it. But it's a really tough time. I don't think in all my, how many years, 30 years of being a doctor, I've never seen anything like this before. Yeah. It's a pretty devastating time.
I've been a nurse for just over 30 years, and I would say the same thing. I've never seen the dialogue that my colleagues have, the mindsets, the attitudes. I've never seen that before.
Not like this.
No.
Not like this. Goodness. No. Well, if people want to see your documentary, how can they see the documentary?
Well, first of all, go to caregiveraLoveStory.com. And as I mentioned, we have a resource page on there, but also we have a lot of upcoming events, some of which are public, that people can join. The film is going to be actually we're very excited, on PBS in November. And we also have an educational distributor. So anybody who's interested in bringing it to their schools or their conferences or anything like that can either reach out to me at jessicazitter.com. There's a contact button, or can reach out to our educational distributor to just do streaming of the film without me. But we really there's many ways to see the film. Go check out caregiveraLoveStory.com and sign up for our newsletter, by the way, because if you sign up for our newsletter, you're going to see more about the distribution. After it's on PBS, we're planning to get a broadcast distribution situation so people will be able to see it more easily. But we're getting there.
Awesome. And we'll have links to all the sites in our show notes so that people can go straight to it. It'll be very easy for them to access. So now here's the bonus question, right? The personal bonus question. With all the changes and the stress and everything that's been going on during the pandemic, we're going to ask you, how has your self-care been impacted, and what lessons have you learned about self-care?
Oh boy, I'm glad you asked that. Leave it to some hospice people to ask that question. It's a great question. Well, I became an empty nester during the pandemic. So it's been a really interesting thing with all the rising stress and of work. I've also had this sort of decrease in terms of my responsibilities at home because my kids are gone. So I've had some time to really think about self-care. I've had some more time to do self-care because I have this emptiness in my house. And I really see the difference. It is so critical. I'm not where I want to be, by the way. I still could do a lot more self-care, but I'm doing more than I used to, which was essentially none. And it makes a huge difference. I mean, it's really critical to just get off that train and get off that track and just shake it up and go do something. Go take a walk. Go sit down and have a cup of coffee in the garden. I mean, these are things I really didn't do that much before because I was always running.
Right.
And I find that doing those things gives me a boost, just like the boost that I'm talking about giving Rick or caregivers like Rick by doing them a load of laundry and giving them something that's that they aren't expecting, just a little bit of a lift of love, whether it's, again, your own self-care or the care of someone else. It's really, really critical. And it's really important that we step up to do that, especially now. We're seeing we're running on fumes. We're all running on fumes, and we've got to, a little bit of extra support from someone else or from yourself really goes a long way.
Thank you for sharing that. That was definitely personal, because when the kids leave home and you're left with an empty nest, it changes things. That's for sure. It does. It changes your life.
Oh, yeah. Your youngest went away to college, didn't she?
She did. But you know what? Here's the dirty secret. She's 2 miles away at Berkeley. She's like, Mom, pretend I'm on the East Coast.
Of course.
She put some boundaries up there. She's grown.
Yeah.
Lots of boundaries.
Oh, I love it.
That's good. That's good. Dr. Zitter, thank you so much for spending some time with us. We always love to have you on the podcast.
Oh, you guys are amazing. You are incredible. You're a great duo team. It's really fun to get interviewed by the two of you together. Thank you so much for having me.
We know that there's a problem in our country today because there's so many caregivers out there and they need help.
It's the elephant in the room.
Oh, absolutely.
And it's a blow-up elephant. It started small, it got big, and now it's really big, and it's getting bigger.
Right, right.
There will be more unpaid caregivers and more people with chronic illness as the baby boomers age that will need this help. And what she is talking about is audacious thinking, audacious problem solving, and that's exactly what needs to happen.
Right. So we've got this twin problem. First problem is that we have these aging baby boomers, the silver tsunami they've been called, and that 10,000 people a day are turning 65.
Wow.
Yeah, that's pretty incredible. But then on the other hand, you have the other problem, and that is that there are fewer and fewer people who are able to take care of those people.
Well, and then when you add all these other swirling things that go with that, reduction in healthcare staff.
Right.
Right? Related to the pandemic, the last year and a half's been a mess for us. And we had a nursing shortage, social worker, and a chaplain shortage before that.
Right. And now it's just become worse because of the pandemic.
Yeah.
So not only do we have a problem having enough professional caregivers, but there's not going to be enough caregivers out there, just in general, family-type caregivers, personal caregivers.
I think to sum up what Dr. Zitter is saying is it's a call to action. We know it's there. The elephant's in the room. Here's a knife and a fork and a plate. Figure out where you want to take a bite. How can we take a bite and eat this elephant one bite at a time and get it down? I mean, it's an audacious ask, but there isn't any reason we can't do that.
Right. And she brought it down to the personal level. If you've got a neighbor who's working as a caregiver, offer to do something to help.
We put in our part. We said if they'll just pay hospice more money, our part could be better.
That's right. That's right. We could provide more care.
Yes. And of course, that's a very, I guess in the big picture, hospice's fraction of those caregivers is infinitesimal.
Right, right. The percentage of caregivers who are actually involved with hospice is not but a very small percentage.
Right. So the picture of caregiver need is way bigger than that.
Right.
So we would encourage you to connect with Dr. Zitter with her blog, her newsletter, connect with her on LinkedIn. You can find her website, jessicazitter.com. She's an amazing speaker, an amazing advocate. You're going to love her work in Extremis. Just check out her website and have a look at what she's doing.
Thanks for listening to The Heart of Hospice. I'm Jerry Fenter here with Helen Bauer. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening and leave a rating or a review on Apple Podcasts.
To connect with us, just send an email to host@theheartofhospice.com. You can also find us on social media. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.